to the Thought Snob Podcast. I'm Paula Swope. Let's get snobby. Today's episode is about alleviating pain with trigger point therapy, which is a technique you can use anytime, anywhere to fix your pain. And if you've been living with chronic pain, the information you'll learn today might help you live a life that is absent from pain. Wouldn't that be a game changer? So I asked this lady right here to come on the show because she is an expert in trigger point therapy. And she's going to provide practical, usable advice on 2 areas of common pain that are widely misunderstood. Her name is Amber Davies, and Amber is a certified myofascial trigger point therapist, licensed massage therapist, and she's the owner of New Day Myo Pain Center right here in Louisville, Kentucky. She is the co-author of the Trigger Point Therapy Workbook, your self-treatment guide for pain relief, the 3rd edition. Her father, Claire Davies, is the original author of this book, and this was published in 2001. It is the best-selling book on trigger point therapy, and it's been published in over 20 different languages. This book is a huge deal, and how lucky are we to have the co-author here to talk about it. So Amber, welcome to the show.
Thank you, Paula.
I'm absolutely thrilled to have you here because everything in America seems to have reached the chronic stages, like chronic disease, chronic stress, chronic pain. And it's like they're all the norm. And so many of these conditions are preventable and curable.
Yep.
Instead of having to take pharmaceuticals like opioids. I know so many people who have gotten addicted to opioids because they were living with chronic pain.
Yep.
And in this book you say relief can be yours without pills, bills, and appointments. And I love that.
Yeah, it's true.
Yes. And so the focal point of the whole book is to teach an easy-to-use, inexpensive self-treatment approach that people can use to fix their own pain.
Yep.
And since the rate of chronic pain among adults is approximately 21% in the United States of America, my goal for this episode is to take that number down a notch.
Yeah, raise some awareness of what people can do for themselves and what's out there in terms of manual therapy, soft tissue therapy, trigger point therapy, massage therapy.
Yeah.
Yeah.
So why don't we just jump in with the most basic piece of this that there is. What are trigger points and what causes those?
Right. So trigger points are a neuromuscular phenomenon. Basically, people think of them as knots. So most of us have had our shoulders rubbed, and there are spots that feel so good and kind of painful, and you really like people to really get in there and dig in there, and you're like, oh, get rid of those knots. Those spots at the heart of them are trigger points. So a trigger point happens where the motor nerve comes into the muscle to tell the muscle to do its job at the neuromuscular junction. And at that spot, that's a chemical message. So at that spot, the sarcomeres in the muscle, the smallest unit of contracture, stays contracted all the time. So we get hundreds or thousands of sarcomeres in this little tiny spot that are staying contracted even if we stretch, even if we sleep, even if we relax, even if we strengthen, until the body reaches a state of homeostasis. And how that is accomplished with muscle is you don't contract it for long enough that the body is able to catch up with all of that extra chemical that causes the contraction. And then there's this cascade that happens where the body sends a message back to the brain and says, oh my gosh, I'm working so hard, and it gets in this energy crisis and sends a message to the brain that basically says, help, help, I need more. And so the brain, instead of sending relax, it sends more contract. So you just live in your life. Maybe, for example, you've moved and you've lifted a bajillion things. You've moved all these boxes, and your arms are sore and tired. We've all experienced that. Our arms are tired, our elbows, our shoulders are tired from all of that lifting. Well, trigger points will form in the biceps muscles, some other places as well, and refer that pain. And then we're like, oh my goodness, this really hurts. I better rest my arms for a couple of days, or a really hard workout. You kind of rest, your body goes back to normal. And if you really overdo that, you develop these trigger points that then make you kind of vulnerable, makes the muscle a little shorter, and you're more likely to develop active trigger points where the muscle is actively causing pain with very little activity. Or every time you go to work out, you're like, that shoulder pain is back again. And then it cascades, and then you have shoulder pain all the time, and everybody else gets involved with that problem as the body seeks to adapt to get away from the pain. So the way to get rid of those trigger points is through some kind of intervention. We got into this therapy, my father and I, because my father had a frozen shoulder in 1995 and 96. And all along that journey, he went to a doctor, and that doctor said, I think you have bursitis. I want you to wear your arm in a sling for 6 months, and it'll take about 2 years to get rid of this frozen shoulder. This is pretty common advice. It takes about 2 years. There's nothing we can do about it. My dad was a piano rebuilder, and he couldn't take 2 years to not have an arm or 6 months to not have an arm. Self-employed. And so he said, I don't like that idea. And he tried another doctor, and he tried physical therapy, and he got worse with the physical therapy. Eventually, he went and bought the medical textbooks on muscle pain, Myofascial Pain and Dysfunction by Janet Travell and David Simons. He had known about trigger points because he'd had a really great neuromuscular massage therapist in Lexington, but she'd moved away. And to be honest, he wasn't patient enough to get into the next person, to wait 6 weeks to get into her. Because it's so painful. It was painful. He wanted a solution, and my dad was a big do-it-yourselfer. So when he finally realized, wait a minute, what I'm doing, massaging the site of the pain, icing my shoulder, trying to move my arm, do the stretches that the physical therapist recommended to me that made me worse, he realized I could do something about this myself. He went and bought the medical textbooks, and within 4 weeks, he'd been in pain for 8 months. Within 4 weeks, was completely out of pain and had use of his arm back. Wow. Self-treating 23 different muscles that were contributing to his shoulder pain. Wow. And so that was his motivation for getting into all of this. He spent a couple years trying to convince all of us to buy this $200 set of medical textbooks. Of course, he bought me a set. He bought my sister a set. And he wouldn't shut up. And he drove us all completely crazy. You know how people do when they get on a topic, right? I'm a little guilty of that. Right. We do it. Like we get a hobby topic and we get excited and we share it with everybody. And, lo and behold, the waitresses he was trying to tell, to buy this $200 set of medical textbooks, didn't do it. And he got frustrated. And he finally decided to retire from his piano rebuilding business and go to massage therapy school and write a layman's version of myofascial pain and dysfunction to bring the work of Janet Travell and David Simons to the people, because it had not filtered down to where it should have been, which was with the physical therapists. He said, forget it. We're just going to go right to the people. People can do this themselves with self-applied massage. So he did that. He spent a couple years figuring things out. He went to massage school, and then he got busy writing a book. That is incredible. As I was reading through this book, and I just want to bring this, because I really want to ask you this question, because at this point I'm convinced that I have what you referred to as long-term postural dysfunction. Yeah. You were talking about just wearing, the muscles out a second ago. I want you to talk about this because so many people spend an inordinate amount of time just slouched over the computer, and wearing their muscles completely out. And I know that I have done that. And so what does that do to our bodies when that is like our repetitive motion every day? That's one of the areas of pain I wanted to talk about. Okay. So many of us sit and work at a computer. All of us sit too much. We all sit and drive. And so we end up with hip flexion. We're bent here at the hips. We're bent at the spine as we lean forward. Our shoulders are pulled into protraction, and our arms are here. And then, of course, as we get into our work, we just get sucked into the computer more and more and more. So everything that's bent gets shortened. All of those muscles get shortened. And what happens is the short muscles don't cry. The long overstretched muscles cry. So in like this, I'm going to end up with pain between my shoulder blades, and I'm going to end up with neck pain, and I'm going to end up with a headache, just like this. And probably some hip pain, buttock pain, low back pain from just sitting in this position all the time. Now, obviously we can take some action, change our ergonomics are super important. Our chair is super important. Our setup, sitting at a laptop. A lot of people were calling me during COVID for video consultations for how to get out of pain because they went from an office space to working at their dining room table on a laptop.
Yep, same thing happened with me. That's when I started myofascial release treatments.
Yeah.
Right.
Right.
Because I was in so much pain.
Yeah.
And it was just this shoulder pain, and I've always struggled with it. And then when I started the myofascial treatments, it helped tremendously. And I did not know that you store emotional trauma in your tissues as much as you do physical trauma.
Yep.
So I've learned a lot about the myofascial piece of this just through doing it myself, and it has been an absolute game changer.
Yep.
But when I read that in the book about the postural dysfunction, I had to bring that up because there was a point in time before I started the myofascial, my shoulders were like coming in like that.
Yeah. Very
and
common.
They're more back now.
Anybody who is a big posture nerd looking at my posture, you can see I don't live here, right, with my shoulders back. I'm not a soldier. My job isn't up here. My job is massage. So this happens to me too. Short, tight abdominal muscles, rolled in shoulders here. And that creates all kinds of pain and dysfunction that I have to work through and manage every day. And so I don't think we get to the point where we stop having these postural challenges. It's that we need more antidotes, more awareness, and not just stretching and strengthening, which is, those are the super tools of physical therapy, stretching and strengthening. The missing piece is manual therapy to the muscles themselves, particularly trigger point therapy.
Okay.
And myofascial release.
Right. So you want to talk about two areas of common pain that are misunderstood. And so we just covered one of those, right?
Yep. So a little bit more in detail. So that upper back pain that's so common between the shoulder blades.
Yeah.
Very, very, very common. I have seen so many people through the years who have seen so many physical therapists, so many doctors, so many massage therapists who are focusing on the rhomboids, massaging between the shoulder blades. People come to me and they say, oh, just really dig in there. I know if we just find that, there's a trigger point that nobody can find. And Amber, I know you're a trigger point expert, so you're going to find that magic trigger point in my rhomboids. And I'm here to tell you, there is no magic trigger point in your rhomboids. The rhomboids, the space between your shoulder blades, is not the problem. If somebody's treated it, dry needled it, massaged it, and you've had a little bit of relief, a few hours, a couple of days, but it just comes right back, it's not the problem, it's the victim. The victims cry, the perpetrators don't. In this case, the perpetrators can be the chest muscles being rounded forward, all these muscles that pull the shoulders forward. So we have to loosen those, not just with stretching, but with massage, myofascial release. Get this tissue to easily live back here. Get the rhomboids and the middle trapezius and the lower trapezius to strengthen and stabilize back here. So it's easy, because we can't remember that. You can't remember to keep your shoulders back. You shouldn't have to constantly be reminding yourself to pull your shoulders back and down. And if we have that pull of that tension from the front. So first thing, we release this. We can release the abdomen so we're not being pulled forward. So that's the postural dysfunction. That's the mechanical piece. Then you have the referred pain, and there are a whole bunch of muscles that send pain between the shoulder blades. And the number one muscle that sends pain between the shoulder blades is in the front of the neck, right here. It's called the scalene.
Okay.
And it makes a deep, achy pain between the shoulder blades. And almost nobody treats the scalenes.
Nobody's ever done that for me.
We could do that today.
Perfect.
I could teach you how to treat your scalenes.
Oh, I would love that. Okay.
Safely.
Yeah.
Effectively. It was one of the first muscles I learned to massage on myself in 1996 after my dad got into trigger point therapy. And I didn't know anything. I didn't know any anatomy. I didn't know any massage. I just was in chronic pain.
Well, and so many people are. Mine started when I was a teenager. I don't know where it came from, but that's when mine started. And I've struggled with shoulder pain, neck pain, back pain for years. And the massage, I've always gotten massages, but it's more like a Band-Aid. Temporary relief, nothing permanent. It's going to come right back.
Wellness massage, relaxation massage is really wonderful for stress relief. It's a really wonderful break and can really down-regulate our nervous system and is very healthy for us. We should all be getting relaxation massage for our whole bodies, if that's appropriate for your body.
Right.
But there's a whole field of what I call outcome-based massage. So massage that like neuromuscular therapy, orthopedic massage therapy, medical massage therapy, trigger point therapy, myofascial release. There's all of these pieces where you've got highly trained massage therapists who specialize in treating pain and dysfunction. So the massage has a goal and an outcome. And it's not just you meet your massage therapist, you take off half your clothes, and you lay face down on the table and you don't talk. That's not the same thing. You're not going to get change to your body if you're going in with a specific problem that you want some help with.
And I think that's really misunderstood because now I just do massage for relaxation. That's the only reason that I do it. But before, I actually thought that I was doing something that would get rid of that shoulder and that back pain. But I've left the massage. I've left out of a massage before and gotten into my car and still been in pain and been like, what? And so I've come a long way over the years. And I know that this has to be misunderstood because you even bring awareness to the fact in your book that you call muscles the orphan organ. Is that right? Is that what you said?
I am quoting one of the pioneers of trigger point therapy, Dr. David Simons. He was an aerospace physician. He helped to put man on the moon.
Wow.
The Man High Project. All right, so with the Air Force, there was this project called the Man High Project in the 50s, okay? And these are the people that are trying to figure out how to keep man alive out there in space. So this is the group of people that were sending monkeys into space. They're testing these things like, okay, how far do we go? And they got to the place where they stopped killing the animals. Things are working out. They get to the place where they're ready to send a man. And it needed to be a doctor because he needed to run tests on himself. And Dr. David Simon said, we are ready and I will go. So,
interesting.
Right. So we're, the people that are the pioneers of treating muscle pain are extraordinary people. Doctors are extraordinary people. It takes an extraordinary person to make it through medical school. It's such an accomplishment.
Oh, yeah.
And, I can't save a life. I'm really good with quality of life, but I can't save a life. So David Simons, he held the record for altitude for decades at the bottom of this hot air balloon. Anyway, so when that project folded and he went to the Air Force, eventually he came across Janet Travell, who was a cardiologist and pharmacologist, and John F. Kennedy's White House physician.
So these people kind of knew what they were doing.
Yeah. So Travell comes along and is teaching a class, and David Simons happens to be in it. And he became fascinated with this topic of muscle pain. So he joined her as kind of an apprentice. And he said, we got to get this woman's brain on paper. And so that's what he did. He was the lead author of Myofascial Pain and Dysfunction and got her brain on paper. So he said, muscle is an orphan organ. No medical specialty claims it. And as a consequence, there is no funded research into the muscular causes of pain. Doctors and physical therapists don't get primary training in the muscular causes of pain. Now we have the internet and you can look up journal articles, you can Google stuff, and information is being shared at a much faster rate. 20, 30, 40, 50 years ago, people had to go to conferences, right? Or they're waiting for that journal article to come out, and then they're talking to each other and they're writing letters back and forth and having phone conversations. And so progress was much slower. Well, there's also no department of myology or myofascists or doctors who get together every day and hang out and solve these problems. The specialists in muscle pain are scattered across all of these different disciplines: neurology, rheumatology, physical medicine, PT. And so the progress has been slow.
When someone tells you over and over again that you can't have what you want, you believe it. And those beliefs, unless they are interrupted, have the power to destroy your life. This book takes you on a journey of self-assessment, self-reflection, and self-empowerment, but it's not a quick fix. It's a playbook to a better life. And if you emulate my spiritual teachings, your life won't look the same 1 year from now. I want you to know that if you want something, you're meant to have it. That burning desire that you've always had is there for a reason. Your intuition tells you that you are supposed to do whatever you want to do, and that's why the burning desire never goes away. You may have shut it out a time or two in your lifetime, but it always comes back. Together, we're going to bring that burning desire to life. You can attract whatever you want, regardless of your past and present circumstances. When we're done with your spiritual transformation, those who have treated you badly will wish they hadn't. Miracles aren't reserved for the saints. We sinners are just as entitled to miracles, so let's go get yours. I think I read this in the book. Muscle pain contributes to pain 75% of the time.
Yes, and so that was Dr. Janet Travell's point of view. I like to, all right, so that sounds pretty astonishing. 75% of common pain is muscular in origin.
Yeah.
All right, so let's assume she had tunnel vision, all right? Mm-hmm. Let's assume it's only 35%. Let's assume it's 25%. Well, how do we deal with that 25%? You go to your doctor, you say, I've got this shoulder pain, and they're going to give you pain medicine. Mm-hmm. They're going to give you muscle relaxers, and they might send you for imaging. Hopefully they send you to the physical therapist, right? And so you've got somebody who's doing stretching and strengthening for this. They're going to rule out breast cancer. They're going to rule out anything else that's going to refer pain to the shoulder, hopefully, right? And all of that piece. But nobody treats the muscle directly. The physical therapist should, and there's a movement towards dry needling, which comes out of trigger point therapy, to directly address the muscle. But very few people are directly addressing the whole muscle, the whole muscular system, and the fascial system. So let's imagine Janet Travell had tunnel vision and it's only 25%. So we're dealing with it with drugs that are not very helpful. They block the pain so you don't feel it. Mm-hmm. Muscle relaxers don't work very well for trigger points and muscular causes of pain. And then we have, let's operate. Let's explore and see what's causing that pain. Mm-hmm. And then we have movement therapy, which oftentimes is successful with physical therapy, but sometimes it's not. And then what do you do? So people end up with the next physical therapist and the next physical therapist and the next doctor, and then you end up with tons of imaging. And you really need your pecs massaged and your infraspinatus and your whole shoulder complex and somebody to pay attention to how you're using your body. Are you sleeping on your stomach? All of these pieces that are feeding the monster.
Well, and I just want to point out something, too. When I was in high school, there was a group of guys that decided to, not take the college route.
Sure.
And they went to work for these cell phone tower companies, and they had to climb. Like, there's no way I would have done that type of climbing. I mean, it was like excessive height. And all of them developed chronic pain, back pain, you name it. Well, they all started taking pain pills, talked about, how good they felt. Well, they had no awareness that the pain was still there, the injuries were still there, they just couldn't feel them. And so they just kept on working, taking the pills. And a couple of them to this day, the ones that are still alive, they're debilitated with chronic pain. In your professional opinion, what happened there was the opioids were masking the problem. They thought they were fine.
They killed the messenger.
Right. And they overworked everything.
Mm-hmm. Yeah. And there's a place for opioids.
I agree.
There's a place for pain medicine, and hopefully it's a temporary resting place until you get adequate care to solve the problem. And then there's, these men had families, I'm sure. They had mortgages to pay, rent to pay, they had mouths to feed. They had to keep going, right?
Yeah.
So what choice do you have? And a few years, a couple decades ago, they were throwing opioids at all of us for everything. For everything. And a lot of people got hooked on opioids that never should have been on opioids in the first place.
Well, and speaking of that, I know someone that was put on opioids, and this was a couple of decades ago, for fibromyalgia. On page 2 of your book, you mentioned that it's common to mistake myofascial pain for fibromyalgia.
Yeah.
And it was just like a couple of decades ago, I started hearing about fibromyalgia, and it seemed like every single woman that I talked to was like, well, I've got fibromyalgia. And I was like, well, I've never heard about this before. How would you rule out something like fibromyalgia?
Well, the medical community has gotten a whole lot better about identifying fibromyalgia versus myofascial pain and chronic myofascial syndrome, myofascial pain syndrome. With fibromyalgia, you typically have widespread pain, sleep disturbances, cognitive disturbances, and it seems to be kind of a roller coaster. You're having lots of bad days, and you suddenly have a good day, and you overdo it, and there's a lot of different symptoms associated. It's helpful to think of fibromyalgia as nervous system freakout. It's basically central sensitization. For whatever reason, multiple reasons, the body, the nervous system gets overwhelmed and no longer can tolerate stubbing your toe. Can no longer tolerate a sleepless night. And it doesn't regulate very well. So people who have fibromyalgia almost always have trigger points. Most of us have trigger points, latent, active, contributing to our pain and dysfunction. Almost all fibromyalgia sufferers have got trigger points. The question is it helpful to treat them? And what kind of treatment is appropriate for that person? If it's somebody who has a lot of skin sensitivity and is hypersensitive to touch, then we start with stuff like, okay, let's take this really soft bath brush, and you go home to your shower, get in a nice warm shower, and you gently take that bath brush to desensitize your skin, to send a message to your nervous system that basically says, it's okay. It's okay. There's no fire here. There's no tiger biting you. There is no reason to be in freak out.
Right.
And then the next step is you take a big a soft inflated ball, like a 10-inch ball, and then you can gently rub that on yourself to further desensitize, acclimate this tissue to touch. It is not helpful to aggressively go into tissue that is hypersensitive, that is mad. The goal should be to calm the nervous system as well as the muscular system. They are connected.
That is very, very interesting, and happy to learn that, because I know so many women that have fibromyalgia. And so if trigger point therapy could help someone with fibromyalgia, it just makes me wonder if it could help with menopause. Because menopause has been on my radar, because I am full-blown menopause and was in perimenopause a whole lot longer than what I knew, and it ripped my body apart. And I had more issues with my muscles during perimenopause than I ever had in my life. I'm assuming that trigger point therapy could absolutely help with that.
Trigger points have a lot of factors. So the biochemical factors of hormones, of mineral insufficiencies, caffeine can make it difficult to get rid of trigger points. There are a lot of biochemical factors involved. And so when you've got, the ups and downs of hormone change, or, not enough testosterone, stuff like that, you are more susceptible to developing trigger points and making it difficult to get rid of the trigger points that you have. And that can be thyroid, that can be menopause, that can be a lot of different things. It's really important to get your hormones balanced and stable for any type of therapy to be effective. And that doesn't mean you have to wait until that happens. Or, if you're hypothyroid and you're working through the medication and it's not perfect, that doesn't mean wait until it is,
right,
that you're not going to be successful. That's one of the benefits of self-applied massage, is you can do it yourself at home anytime you you need it. You can treat yourself in the middle of the night. You can treat yourself on vacation. You can treat yourself multiple times a day. It doesn't cost you any more money than the resources and the tools, which are pretty inexpensive.
Right. Well, and it's funny that you brought that up about the testosterone, because when I had my blood work done and realized that I didn't have any testosterone. I mean, it was just pretty much done. That's when I was having all of those problems with my muscles. That is very interesting. And then frozen shoulder is a huge symptom that comes along with menopause. And we've already talked about frozen shoulder, but we have not shown anyone this. And so there is another book, the Frozen Shoulder Workbook. And I looked this up earlier, and both of these books are available on Amazon. I know that for a fact.
Yep, and you can, if you've got a Barnes and Nobles around, or another, bookstore, Carmichael's here, for example, you can go in and you can request the book. They can order it for you. Sometimes it's on the shelf. This book is, the Trigger Point Therapy Workbook has been around since 2001. There's the first edition, the second edition, the third edition came out in 2013. So there are books around. I highly recommend the third edition. It's a major revision. The Frozen Shoulder Workbook, I wasn't involved in helping with the Frozen Shoulder Workbook very much. My dad, we took photos. So there's a lot of photos of me and my dad in the book. And then he did all the drawings.
That is so cool.
The Frozen Shoulder Workbook is kind of interesting because not only does it have self-treatment, it has partner treatment and clinical treatment all mixed into the body of the sections that are about the different muscles and what to treat. The Trigger Point Therapy Workbook is 95% self-applied massage. You can apply it and work with your partner, your husband, your wife, your friend, and then there's a small section in the back targeted towards manual or massage therapists.
It is so easy to understand. It's like just laid out perfectly for someone like myself that doesn't understand how all of this works.
It's written for the layperson.
Yes.
So we didn't do the research on what trigger points cause what referred pain or where that referred pain shows up. That comes from myofascial pain and dysfunction, the Trigger Point manuals by Dr. Travell and David Simons. So all of that basic information. But my dad took this information and put it into a usable format that everybody can understand, that everybody can read. The drawings show, for example, a colored pain pattern. And then my dad took those and made a simplified drawing. Like I said, he was a big do-it-yourselfer, and he worked better on his own. So we collaborated. But he took this information and put it into a format that everybody could read and understand, keeping the essential information, the science, stuff like that.
Well, your dad clearly had a life purpose.
It's so interesting. He didn't start out as a massage therapist, right? He started out doing a lot of other things. And he ended up here. It's like all the things in his life added up to going to massage school. How old was he? 59 or something when he went to massage therapy school?
Oh, I didn't realize that he was that age.
He went so he could write the Trigger Point Therapy Workbook. So he would have a better understanding of anatomy, of massage, have his hands on more people's bodies, have more people to practice the self-treatment. And then he got a contract to write this book. So he was a self-treatment master. I went to massage school so I could help my dad teach self-treatment classes. I didn't really want to be a massage therapist.
Okay.
To be honest, I thought that was kind of gross. It's like, okay, I have to touch other people. Well, right. I tell you, I was in massage school one day, and I was like, okay, I can do this. I can totally do this. Mm-hmm. I don't have to work on anybody I don't want to work on. I can work for myself, and, I just love helping people now. I love it.
Yeah.
So after our book came out in 2001, we traveled and taught continuing education to massage therapists for 2.5 years. Mm-hmm. All over the country. We taught, I forget, was it 33 classes together? He was the lead. I was right out of massage school, and I was the assistant, and I ran the workshop business, and it was a wonderful training ground and was really fascinating. The muscles that I had mastered on myself, the scalenes, the subscapularis, the quadratus lumborum. Massage therapists will recognize those names. PTs will recognize those names. These are difficult muscles to self-treat and sometimes to find on other people. The ones I had learned and mastered on my own body, I could find them on everybody in the room. And I knew them better than those professional massage therapists. So I had something to contribute. And then, of course, I got my hands on, 25 people at a time in a class. And I got really good at palpating exactly where those trigger points happen. So they happen in predictable patterns in the same place on just about everybody. There's some variation. But I can walk up and zing your trigger points. And they're painful when you press on them. They're not present all the time. Right? It's not like we're all walking around with trigger points in all of our muscles. Some people are going to have a whole bunch. Some people are going to have a few. They happen in predictable places where that neuromuscular junction gets overwhelmed and cranky from overuse, injury, sudden contraction, sudden stretch, stuff like that.
I can always tell when someone has hit a trigger point with me because it's like the pain will radiate.
Yes.
Like I had some neck pain about 3 weeks ago that was just driving me nuts. I know exactly what I did to cause it. I won't get into all of that, but someone was working on found a trigger point back here and pushed on it, and I mean the pain like radiated up through my head. And she said, well, I mean, you've got a trigger point. And I don't know that I have ever felt that on myself. And so what does it feel like to you? Like when you find, is it a
when
knot?
I'm working on somebody else?
Yeah.
It depends on which muscle I'm working on. So if I'm going to work on the upper trapezius, this top of the shoulder, I don't feel knots. I don't feel knots at all. I feel tension in the muscle. Sometimes the whole top of the shoulder will be really, really dense and tight and difficult to get into. Other times it's a little more supple and we can get in there and we can find specific fibers. And it almost feels like like a band of spaghetti or a guitar string. And then you search along that spot for the spot that is most tender. If you're working on someone else. On yourself, you're just sitting there thinking, okay, that's tight. That's kind of tender. And you're more aware of the sensation that your brain is telling you about your shoulder than the palpation sensation of your fingertips. So if I'm working on you, I know where the trigger points happen, but I could be a little bit off. And so I have to search on you specifically, and I'll watch really carefully, and we communicate a whole lot because trigger points are painful when you press on them. And to me, the whole art and beauty of the therapy is to only press hard enough that it's therapeutically delicious.
Okay.
A little bit painful, but you like it. You're still able to breathe normally and relax. It's not too much, it's not too little. So I treat it a little bit, give it a little love, improve the circulation, but I don't feel a knot. I just feel tight, but we're looking for the painful spot. And, we're trying to change the biochemistry so it can, I don't force the sarcomeres to stretch and elongate. I don't force that fiber to release. I can't. It doesn't work that way.
Right.
I stimulate the body to go, hey, remember how you really want to be?
When you learn how to do this yourself, it's way, I think, probably sustainable because you can treat yourself at any time, anywhere, just like we said before. But then you also know what level of pain is good for you.
Yes.
Because I've been in situations before that the level of pain was not good for me.
Yes.
It can get pretty intense. And I never did know if that was necessary. I had a lady give me a massage. This has been a long time ago. And she said that she was working on my trigger points. I don't think she knew what she was doing. I swear to God, Amber, I was bruised all over. Bruised.
That is, so originally years and years and years ago, the people that started myotherapy were much more aggressive. And there was much more movement. It was kind of a combination of physical therapy and massage therapy, but it was more aggressive. There was a lot more exercise and stretching with it. And through the years, we have gotten more gentle. There are a lot of people who would say, well, trigger point therapy is press and hold, and you press till it hurts, and you press, and then there's all this dogma. You press for 30 seconds, you press for 60 seconds, you press till it releases. There's all of these different ideas. I'm a myofascial trigger point therapist. I have been self-treating trigger points since 1996 on myself and learning on other people. I've worked on thousands of people. I've taught thousands of people. The right answer is do what's right for that tissue today. There's something, kind of magic that happens when you go to somebody you don't really know at all, or maybe don't know very well. You take off a bunch of your clothes and you lay face down on the table on your face. Most people get a little passive, and you're told, "Oh, let's be quiet. You can relax." And especially people who are prone to not being very assertive or to be passive, they don't speak up, and they'll just accept, okay, well, she knows what she's doing. She's a massage therapist, or she's the trigger point therapist. She can feel it. Or they'll say, well, just get in there and do what you have to do. And I need your nervous system to relax. I need you to be able to relax into the treatment. And if I'm pressing too hard, it doesn't work as well. And it took me a few years to really get that and really learn that. So for me, I believe that 95% of the time, less is more. 5% of people need that, what I call slash and burn massage, need super aggressive to get the trigger points to release. And I kind of question that now. I'm using some other therapies, frequency-specific microcurrent, and some other techniques that I'm having a lot of success with for those stubborn trigger points for that tissue that doesn't want to let go. It addresses the nervous system differently. So it makes me go, those people that really wanted that super aggressive, how would they have responded if we'd done things differently?
Right.
What's most important is that you communicate. It's not okay to get hurt at the massage therapist. Open your mouth.
Well, that's why I wanted to bring that up, because so many people do, and I have. And then I was
too.
I was always under the impression that, and I have even said this to massage therapists, you got to hurt me to help me. I've said that because I really thought that was the case. But you're right. I didn't even think about the situation with ramping up my sympathetic nervous system and going into fight, flight, freeze when I don't freaking need to be. I'm supposed to be there getting therapy. I'm not supposed to be in that nervous state. So I've just had a big light bulb go off. Yeah. I've never had anybody explain it to me that way before. So that's fascinating. And people listening, they need to hear that.
YouTube is full of videos of self-applied trigger point therapy. I have not yet made YouTube videos. It's not my forte. The world is full of videos that are based on the ideas of my dad's book and other people's books and stuff that they're coming up on their own. And they're laying on the floor on a lacrosse ball. They're being super, super aggressive, and they're hurting themselves. And that's what you find when you go searching for trigger point therapy. People have discovered, trigger points are knots that hurt when you press on them. Let me press on this knot. Yes. Most trigger points refer pain away. 85% of the time, the problem is not in the place that hurts. I totally made that number up, okay? In my estimation, 85% of the time, the problem is not in the place that hurts. Mechanically, I do this all day. So my rhomboids, my upper back hurts, I get a headache. That's not the problem. That's not where the problem is. The problem is here with this posture, the ergonomics, release this stuff, take more breaks, reduce the stress, massage stuff, breathing.
You brought that up in the book because, I read that there are certain things that can make the trigger point therapy not as effective. And I've learned so much over the past couple of years about breathing, and I teach pranayama, and it's just such a game changer because, and in your book you talk about this, how we're always breathing through our chest and not our diaphragm. And your breathing can actually change your mind. I mean, you have so much power with your breath. I love the fact that you brought that up in the book because, realistically, because we're getting ready to get into doing some demonstrations with the do-it-yourself trigger point therapy. And that's one of the things that will interfere with somebody getting like the most effective results possible, right? It could be psychological factors, and maybe they're always their sympathetic nervous system is turned up and they're just always breathing real shallow. And
right? It's, chest breathing shallow here, overtaxes the accessory breathing muscles, the scalenes, the serratus posterior superior, the serratus anterior, stuff that, so the scalenes get overtaxed, and you're crunching your diaphragm, right, when you're forward here. So you can't get a big breath. And then, of course, we get the, oh my God, don't be fat, God forbid,
Hold your belly in.
hold at all costs, right?
And it's caused me so much back pain over
oh
the
my
years.
gosh.
Oh my God.
And it's such a, this idea of strengthening the core, and that one of those core features of Pilates, strengthening the core, holding that belly in, is such a great idea, but it's not a great idea to do it all the time.
No, I had such...
You cannot breathe.
Oh my gosh, no. And I had terrible back pain when I did that. I mean, I would suck my belly in and be in so much pain. I don't do that anymore. I just don't. Before we get into the techniques, there's something that I do not want to forget to ask you. And I was blown away when I read this in your book, because I know I've experienced some of it. You say that trigger points can mimic many other conditions, cardiovascular issues, chest pains, heartburn, headaches, all sorts of things.
Yep.
So genital pain.
Yep.
Yeah. So how? Like, how does that work?
Well, so trigger points don't cause disease, right? They don't cause heart disease. They don't cause endometriosis. They don't cause interstitial cystitis. All of the, interstitial cystitis is a great example. You're going to have secondary myofascial pain. So if you've got a condition that breast cancer can refer pain to the shoulder. If you've got that referred pain from an internal organ or a disease process referring pain, the area where the pain is those muscles are going to develop secondary trigger points. They'll be tender to the touch, and they will send their pain, and you'll have, people come in all the time and goes, oh, well, it's, it changes all the time, changes from day to day. When people don't respond to the treatment, you got to go, well, why? What's the first domino in this chain? So a chronic condition like endometriosis, we can't expect trigger point therapy to eliminate that pain. But after a flare of endometriosis, you're going to have a ton of abdominal trigger points that are at least contributing to that pain, contributing to pain when you're out of a flare, making menstrual pain more painful for everybody. Abdominal trigger points in your abdominal obliques that you can massage yourself. So in between periods, in between cramps, times of cramps, massage your abdomen to find these little tender places and give them a little love to help release that pain. There's genital pain is a whole topic for men and women, and there's a subspecialty of physical therapy that specializes in treating intrapelvic muscles and intrapelvic pain. Now they've done a really super great job of learning how to treat the intrapelvic muscles, and sometimes they have forgotten about the external muscles that refer pain to the pelvis, like the adductor muscles refer pain up to, the bladder, to the uterus, to this lower abdomen. The abdominal obliques, testicular pain in men can be from abdominal trigger points. Here's what you do. So what do you do if you have, testicular pain? Somebody I used to be very close to, this is how he learned about trigger point therapy. He was like, I'm dying of testicular cancer, Amber. And I was like, let's call Dad. He was like, not everything's a trigger point, Amber. And I was like, shut up. And so I'm like, Dad, what causes testicular pain? I looked it up in my Trevelyan-Simons. And this abdominal's like, lay down. And I treated his abdomen. And he goes, Amber, not everything is... It's gone. My pain's gone.
Isn't that something?
It is. So how about if you have got the trigger point therapy workbook on your shelf, how about when you have pain that is not the kind of pain that you should go to the hospital for? Chest pain, you go to the hospital. You rule out the stuff that's going to kill you.
Right. Don't
mess around. Rule out the big, scary uglies, right? While you're waiting for the appointment with your urologist, this happens in a week from now or 2 weeks, get out your trigger point therapy workbook. Look it up. Ask the question, what is the role of muscle in this pain? If muscle is contributing to this pain, what trigger points would I work? What refers to this area? Which muscles contract? Which muscles are stretching? What's happening? And let's see if I can improve this, give myself a coping strategy. And a whole bunch of times you're going to solve the whole problem. And if you're still worried, the pain's gone, but you're still worried about that testicular pain, keep the appointment and go to the doctor. Make sure everything's good.
Right. Well,
I can't keep you from dying.
Right. But that's a perfect example of what you said earlier with the testicular pain, because although it was in that area, it was coming from someplace else.
That's right.
Yeah, people need to know that.
And this is the missing piece. Like, doctors are not trained in muscular referred pain. They're trained in organ referred pain. They're trained in the things that can kill us. I mean, there's like a hierarchy of learning through the last 300 years, right? First it was, okay, how do we keep the bones? How do we set the bones? How do we heal the wounds? How do we, treat different diseases to keep people from dying? We've gotten pretty good at that.
Yeah.
We're not so good at the quality of life stuff. So they have not
you're
gotten
right.
down to studying muscle. They just, how many years ago, 10, 15 years ago, they came out with an article saying that they discovered a new organ. I don't know if you caught this article. They discovered fascia.
I think I did see that.
Yeah, and this was kind of a silly article because, the medical community knew about fascia, but maybe they hadn't been thinking of it as an organ. And, for hundreds of years, people have studied human anatomy in cadavers, so and dead people, and taken things apart and gone, oh, well, that liver is black and enlarged. No wonder that person died, right? They figured stuff out that way. Well, with muscle, you cannot study the muscular causes of pain on a cadaver because of rigor mortis. Everything contracts. So all those sarcomeres with the trigger points, for example, they're just contracted. You can't see them in cadaver tissue. It has to be live tissue. The fascia is, looks inert, when in reality, it has many, many jobs, many, many purposes, and is super important. But all these years, they've been taking that connective tissue and tossing it in the bucket. They didn't realize it was important until, recently. Now there's whole conferences about fascia.
Right.
Well, there were massage therapists and Rolfers, structural integrationists, people who have known about fascia for decades and thought it was important. But we didn't have the research. We didn't have the attention of the medical community. It's like, it's not going to kill you.
And you can't test it.
Take a medicine.
You can't test for it.
Right. So what do medical doctors do? What are their tools? Their tools are medicine, surgery, refer out to a physical therapist or an audiologist, some other piece in there. Those are their tools. We've gotten better at understanding things through imaging, but it's only been, 15 years since we could image a trigger point in a research setting.
Wow. You brought up IC, interstitial cystitis, and I was diagnosed with that in 2016. It was 2016 or 2017. But after years of struggling with urinary issues that I just could not make any sense of, and I had this doctor that kept saying I had UTIs, which didn't even make any sense, and was pumping me full of Cipro, and it was just ridiculous. Started learning a whole lot about it after I got an official diagnosis, and of course they will tell you that there's no cure, and it's very misunderstood, and the health insurance companies don't cover the medication, which the medication doesn't really work anyway. I mean, it gives you like a temporary relief when you have a nasty flare. But when I started doing MFR, myofascial release, I saw some improvement. Sitting here today, I'm asymptomatic from the IC. Between the MFR and meditation, I released enough inflammation from my body, and I don't have a trace of IC right now.
Yay, let's keep it that way.
Right. And so I had to bring that up, for people that are listening, because I think that most people, and I don't mean to insult anybody, but, and I love my doctors, westernized medicine. I do too. I'm always going to see my doctors. I break my arm, I'm going to thank God I got a doctor,
Yes.
But I think that most people think that that's the only way, medicine is the only way, when really a lot of these problems that people have are absolutely preventable and treatable without the bills and the appointments and the pills, as you say.
We've developed this whole industry outside of allopathic Western medicine, alternative medicine, complementary care medicine, because the medical establishment wasn't willing to spend the time and energy and money trying these other ideas. And so they've been developed kind of outside, and now there's a lot more acceptance of this other stuff, the alternative, the complementary care stuff. And part of the problem is knowing who to send people to, right? And the insurance. Like I don't accept insurance. I'm a one-man show, so it's not, I'm not accessible to everybody, which there should be a lot of people who do the kind of work I do. Physical therapists and physical therapist assistants should be doing the kind of work that I do, and have highly trained massage therapists in those practices covered by insurance. Massage is not always covered by insurance. It's a problem. But there is definitely a place for Western medicine, and we in alternative care sometimes can throw stones and go, oh, the doctors are messing it up, and they're getting the diagnosis wrong and all that stuff, and we get quite frustrated with the failures. And I think if we could all just recognize the importance of what allopathic medicine does, and the importance of looking outside that box. I love it when people come to me and they say they can't find anything wrong with me. They've done the tests, they've seen the specialists. People get frustrated because they're frustrated that they can't find anything wrong with them. And the good news is they can't find anything wrong with them. Okay, great. All the obvious, it's going to kill you, it's going to ruin your life, but you still have this pain. Everything has been looked at except for neuromusculoskeletal.
Because if you're living with this type of chronic pain, and if you don't seek treatment and get help from someone like you, then that's just going to spiral.
It can.
And you're going to, the depression is, how many things are linked to living with chronic pain? It's terrible. Early mortality, depression, suicide, drug addiction.
Unnecessary surgeries,
right?
Unnecessary medications,
right?
Medical debt, not being able to work. It just goes on and on.
It goes on and on. So just for my own knowledge, and I'm curious, I have this old foot injury from 2002. It was nasty. And I've got a steel plate and 6 screws in there. And I will still feel some achiness in that part of my leg, but there's really no reason why I should, because it's healed. But then I will favor like my right side, because I'm aware of that injury. So it's up here, but I've had some muscle pain on my right side, like from exercising and stuff when I'm doing balance things.
The adaptive stuff.
Yeah. And so would you talk about that for a minute? Because I know I'm not the only one.
No, that's so juicy. Because you broke a bunch of stuff, right, in that ankle. And so you've got plates and screws to stabilize it. So when we break stuff, then we're more prone to arthritis, right? And so we just go, oh, it's achy when the when the barometric pressure changes, blah, 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 blah. So let's talk about arthritis for a second. So we call pain arthritis. Pain with no good reason, right? The achiness in the joints, it gets called arthritis. And when people come to me and say, oh, I have arthritis, I say, okay, well, has that been imaged? Is it osteoarthritis? Did they see it in the joint? Or did you just go to the doctor and they said, oh, you've got pain, you're getting old, you just have arthritis? Because I want to know there's a difference, right? Is this diagnosed? And even if so maybe you go and you have an image and your doctor goes, oh, there's arthritis. And, you're really getting old there, Paula.
Yeah.
Right?
Right. Yeah.
Right? No. So there might be arthritis there, but then the question is, what is the role of muscle in this pain? Are there muscles that were injured in the initial injury that were compensating along the way or had to work really hard to stabilize and protect that joint and then had to rehab through that stuff that still are harboring trigger points that are short and tight, the fascia short and tight? What can we do to improve the available range of motion and function in that whole complex? Your foot, your toes, your ankle, your knee, all of that stuff to improve that. And we can get into helping to repattern your nervous system. You were born with these central pattern generators. Your brain said, this is the muscle that does this. This is the muscle that does it next. This is how we move. This is blah, 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 blah. And then you lived your life. right? Accidents, injuries, blah, blah, blah. And so the body adapts, just like you were saying. On your right side, you have these pains when you're working out on the right side. The body is amazing and brilliant at figuring out how to function without pain, because it gets the message of, oh, broken, need to heal. Take the weight off, take the pressure off, take the movement off of this spot, right? It's brilliant. Problem is it doesn't get the message that, okay, I'm all healed now and I can go back to my old range of motion. So we have to intentionally go to physical therapy, go to massage therapy, get that tissue to change and soften so we can regain the function in the side that's injured. And we can do that with techniques, neuromyofascial mobilization, mover stabilizer, where I can get the main muscles to turn back on, the stabilizing muscles to turn back on, so the muscles that are supposed to be movers are available to do the moving and are not working all the time. So that's exciting stuff that I've been learning the last few months, the myofascial mobilization and mover stabilizer. I love learning new things. It bothers me when I can't help people, and so I'm seeing that work change my practice and the frequency-specific microcurrent. And I'm thinking a lot about these adaptive patterns, how we got there, what else is contributing, and how we can move back to a more normal or typical range of motion.
Well, you're not just putting a Band-Aid on the problem. I mean, you're getting to the core of the problem, and you're solving it. And so for anyone that wants to see you, what do they do?
So I have a website, newdaymyopain.com. Myopain, myo means muscle, MYOPAIN, newdaymyopain.com. And you can go there and you can read about my work. You can read about the Trigger Point Therapy Workbook. You can read about what it is that I do. And you can make an appointment through that website. So if somebody's seeing this podcast and they're not in Kentucky or they're not in the Louisville area, give me a call. Let's talk about what it is that you're struggling with and how I think I may be able to help. It's ideal to have a local therapist that you can go back to repeatedly. The reason to come see me is to learn the self-treatment, load up on a bunch of therapy. But I like to make sure I think I can help.
Sure.
I don't want people to spend that time and money coming to see me if I don't think I can help.
Can any of these treatments be carried out virtually?
Yep.
Probably not. They can?
Yep.
Oh, okay.
Yep. I used to do phone consultations with people with the book. So I would describe over the phone how to do self-applied massage. But now with video, it's super helpful. So we do self-treatment together. We have the tools. I can see, okay, by the angle of your body, you're not on that muscle. I can see if you're overworking because you're pressing really hard and your face is going like this. And super helpful. So people can schedule those types of sessions on my website as well.
Okay. And we will include all of that information with this podcast too. And I'll also put it on my website at paulaswope.com. So we'll just make it super easy to find.
And if people want to look at the Trigger Point Therapy Workbook, you can find it on Amazon.com. Read the reviews. And check it out.
It's absolutely fantastic. I cannot stress how easy it is to understand. Because typically when you pick up a book like this, you're like, because you get into all of these terms that you don't know and you become intimidated and you're just like, well, forget that. No, this is not the case with this book. And then, let's see. And then this one is the Frozen Shoulder Workbook.
By Claire Davies.
So both of these books are available on Amazon, and then you said they're also available at Barnes & Noble?
Any bookstore.
When someone tells you over and over again that you can't have what you want, you believe it. And those beliefs, unless they are interrupted, have the power to destroy your life. This book takes you on a journey of self-assessment, self-reflection, and self-empowerment, but it's not a quick fix. It's a playbook to a better life. And if you emulate my spiritual teachings, your life won't look the same 1 year from now. I want you to know that if you want something, you're meant to have it. That burning desire that you've always had is there for a reason. Your intuition tells you that you are supposed to do whatever you want to do, and that's why the burning desire never goes away. You may have shut it out a time or two in your lifetime, but it always comes back. Together, we're going to bring that burning desire to life. You can attract whatever you want, regardless of your past and present circumstances. When we're done with your spiritual transformation, those who have treated you badly will wish they hadn't. Miracles aren't reserved for the saints. We sinners are just as entitled to miracles, so let's go get yours.
All right, so you were telling me about some upper back pain, some shoulder pain that you've been dealing with for a long time. Can you tell me a little bit more about that, where you have it and why?
Yes, so it always starts at my shoulder blades.
Mm-hmm.
And then it will, I can sometimes feel like a burning sensation in between my shoulder
I'm
blades.
going to hand you a tool.
Oh, yeah.
And you can reach over your shoulder and show me.
Okay.
Like draw it, not where it hurts to touch, but where you have symptoms.
So it always starts right there.
Okay.
On that left side.
Mm-hmm. And it feels good to massage.
Yes.
Does it ever feel worse when you have, like, you go to a massage therapist or if Will rubs it or anybody else massages here? Sometimes it can be too much.
Yeah.
Okay. All right.
So it starts here. The left side's always more noticeable.
Okay.
And then here around this other shoulder blade.
Is that a little lower than the other side, or is it about the same?
It's a little lower.
Okay.
This left side right now, definitely there's some pain there, and it's a little higher up, like it's like right there. Mm-hmm. And then on this side, I don't have a whole lot of pain, but like right there.
Kind of cranky.
Tender,
talkative.
Yeah.
Does it hurt to take a breath?
No, not right now. It has in the past.
But not recent past?
Not real recent, no.
Okay. Not the last few weeks or last few months.
When I had some neck pain about 3 weeks ago, and it was so bad that it did hurt to take a breath at one point.
It hurt in the back of the neck.
Mm-hmm. And I know exactly what I did. I know what caused it, and it was stupid. But it lingered. Like, and that's when I was talking about the trigger point. Mm-hmm. When she pressed on it, and then I felt like the pain radiate like through my head. Mm-hmm. That was when I had that neck pain back here. And then it traveled down into my shoulders, and it's still not completely gone. Okay. And then in between my shoulder blades.
Oh, right.
I don't have that burning sensation right now.
Mm-hmm. Comes and goes, different times, depends on what you do.
Right, right. Now, when I sit at my desk all day, if I'm not aware of what I'm doing, then I will get that burning sensation by the end of the day, and then it will travel all the way down.
Mm-hmm. And is it a vertical or is it a horizontal pattern as it comes down here?
More horizontal.
Okay. All right, so I've just drawn basically kind of a picture of what she has described to me. I'm going to check it out, see if, does that seem right to you?
Yes.
What else? Am I missing anything?
I don't think so, no. No, now sometimes at the top of my shoulders, when it's like really bad, it will just kind of ache. Okay. Just ache. And I've even had, sharp pains that will like shoot down into my arms at times. Now, I haven't experienced that in a while, but I have had that happen. Okay. Just in case anybody's watching that's experienced that. Sure. I have experienced that.
Yes, and things come and go, depends on what you do, but not necessarily related to an injury, except for maybe, I think you had said that the upper back pain maybe started when you broke your leg.
It didn't start then. I had it before that, but I think that's why the left side, as always, I feel everything more on that left side than I do the right because of this injury. Okay. Because it's like the left side of my body. If anything's going on, it happens on the left side. Mm-hmm. It's so weird.
It's all connected, right? So you change this foot has to, you can't walk on it. You have to use crutches. It has to rehab. That all has to happen. You wear the boot, and then your pelvis is all goofy because this boot has got you jacked up too high. Mm-hmm. Just a tip: wear a shoe that's as tall as the boot, or buy a little thing that fits onto your shoe so your pelvis is level. It will save you weeks and weeks of agony. But then you have all that compensation pattern. You got the crutches, all of that stuff going on, or the scooter thing that you're using, so your body can heal this leg. But then you've got the consequences, right? You've got that leftover. This hip has not been, you've been holding it up, or you've been keeping it, on the scooter, so the hip flexors are all goofy. So, if you're coming to me over time, we're not going to just treat the back. We're going to try to figure out the why. And what's happening with the leg, the foot, the pelvis, the whole body, so we can keep this from coming back all the time.
Mm-hmm.
Now you get massage, is that right?
I get massages pretty regularly, but that's, just for relaxation. But then I do MFR.
Mm-hmm.
And I was having MFR treatments once every 2 weeks.
Mm-hmm.
And then now I'm down to once per month. And so when I was having MFR twice a month, I did not have any shoulder and back pain. Like, it was pretty much gone.
Now, what would happen if she had been out of town, or you'd gone on a simple vacation or something like that, and you missed that 2 weeks? So at week 3 and 4, your back is aching.
If it was a situation where I was sitting a lot at that computer, I would be in pain.
Right.
If I had been on vacation, I had been more upright, moving, walking around, I probably wouldn't be in pain.
And you've had, I'm going to take this tool from you.
Oh, yeah.
You've had a massage. They've focused on the back, the myofascial release, although she's not just focusing in between the shoulder blades, she's focusing further down your back.
Everywhere.
She treats your abdomen and your chest and all that stuff. That's excellent. So MFR, myofascial release, that's excellent. So it's changing that pattern of the fascia. If you don't know what fascia is, have you ever, this is kind of disgusting, but have you ever cut up a whole chicken?
Yes.
Right. And so you're pulling the leg off the thigh, and there's kind of this membrane, this film that you kind of, it's not the fat, it's not the skin. There's this membrane. That's fascia.
Okay.
And fascia encases groups of muscles. It's under our skin, and it encases the fat. It's like the bags that hold everything in. And then all of the fibers, there's layers and layers and layers of fascia that hold in the fibers. So if you think of roast beef, as it breaks apart, as it's cooked, that's the connective tissue breaking apart. That's fascia.
Okay.
And that fascia gets bound up and tight and restricted. And it follows, what we do, and scarring and all kinds of stuff that affect these big picture patterns. So the question is, how do we get you to a place where you don't have to have the myofascial release just to stay out of pain and stay comfortable? Or, hey, what if your back felt better so she could move down to your legs?
Right.
Or other areas.
Mm-hmm.
So first of all, I'm thinking about how common this pain is between the shoulders. As I mentioned earlier in the podcast, people, just about everybody who called me for a video consultation during the lockdown had pain in the upper back. Mm-hmm. And inevitably they were sitting at a laptop, they're all crunched forward, and they were really struggling. Mm-hmm. Many of them had seen some YouTube videos, and they're using the lacrosse ball on the floor, and they're just killing themselves and not finding any relief. And that's because the problem is not in the place that hurts. If it were in the place that would hurt, that lacrosse ball on the floor would help, right? But the massage would help, and it would change it, but it just keeps coming back over and over and over again. Mm-hmm. So first of all, the easy thing to do is obviously to treat where it hurts. So say somebody's not had massage before, they've not tried any of these things. The things that they can do, they could get a tool like the Theracane. These are available on Amazon. I'm going to hand you that.
Okay.
Right. So say you're new to this and you just want to massage. You could take your tool, you can massage through the upper back, all of that stuff. If you're not solving the problem, it comes back in 10 minutes, half an hour, 2 days, and you're just having to massage that area over and over, you go, okay, well, what refers pain here? Mm-hmm. And there are a bunch of muscles that refer pain there. There are muscles behind the shoulder blade that refer pain to the back. There are muscles in the front of the neck. And this is the most common one. And a simple thing that we can do, that we can all do without having to know anything, other than the first rule of massage is we don't massage a pulse.
Okay.
Okay. So I'm going to teach an easy one in the scalenes. So I have my collarbone here, and I'll have you feel your collarbone. Mm-hmm. And right here in front, as I turn my head, you can see this big, strong muscle. There it is. This has a fabulous name, the sternocleidomastoid muscle. So right here, she's got a wonderful SCM muscle. It turns the head. Just on the outside of that muscle, just above the collarbone, I'm going to press down. I'm going to have her relax her neck and turn back to the back to neutral here.
Okay.
And so I'm going to have you take your little finger and you're just going to reach in behind the collarbone here. Is this tender here?
A little bit.
Okay.
Oh, yeah.
All right. Now let's put that on a number scale of 1 to 10. So, 0, no pain, 1, tiny pain. 10 is the place where you're yelping ouch and trying to get away.
I mean, this is probably at a 2.
Okay, great. So I'm gonna increase it a little bit. I'd like to go up to a 5, and
Okay.
we'll call 5 your perfect level of pressure, where you don't want any more, but you don't want any less. You're able to breathe normally and relax. It's a little bit painful, but you like it. Therapeutically delicious.
That right there it's starting to feel pretty intense.
Okay.
I mean, I could handle more.
Of course.
Yeah.
Yeah, you could take it. And certainly if I said this is going to solve your problem, you'd be like, bring it on.
Bring it on.
This is not no pain, no gain. This is, oh, it's okay, little muscle.
Yeah.
You don't have to work so hard right now.
So this is considered what I'm feeling right now. We're at like a 5.
No. Is this, let's see, so let me describe it like this. Do you want more pressure or are you still able to relax?
I'm able to relax.
Mm-hmm. Does it, if I pressed a little harder?
That's pretty intense right there.
All right, look at her face. See, she's squinting her eyes a little bit.
Mm-hmm.
That's like a 6 or a 7.
Oh, yeah.
Yeah. Now, when she starts to grimace her face, that's a 7.
Mm-hmm.
8 is statements that you're thinking like, oh my gosh, that really hurts.
Mm-hmm.
9 is you're thinking swear words.
Yeah.
All right. And 10, you're thinking about calling me swear words or
Yeah.
trying to get away. All right. So that's the scale that we're on. So let me have you take the middle finger of your left hand and put it right here where this spot is.
Middle finger of left hand. Okay.
Now you've got some good nails.
Yeah.
So I'm gonna have you bring that in right here.
Okay.
So right next to this, I'm gonna show you here. So I've got my sternocleidomastoid.
Mm-hmm.
I can really see it, and you'll be able to see it in the mirror. And I'm gonna be just to the outside of that and above my collarbone.
Okay. So I'm just going to press in just like you did, right?
Mm-hmm. Yep. And for do you feel a pulse there?
Yeah.
Okay. So I'm going to have you move. I'm going to touch it again.
Okay.
Very shadowy, very light. And if I move over here, I feel it more. So I'm catching the subclavian artery. So I'm going to move around a little bit until I'm off of that artery.
Okay.
So right there. So let's have you just kind of fine tune that. And if you're worried about whether or not you can feel the artery, so if you pour salt on the tabletop, can you feel the salt on the tabletop? Can you feel it between your fingers? If you can feel that, you're going to be able to feel a pulse, all right?
I can't feel a pulse here.
Okay, great. All right, so that's a good spot to massage. Is that tender?
It is.
Okay.
Yeah.
Now the direction of pressure, you can press down towards the floor from this position.
I feel it in my right shoulder.
Okay, so back here.
Mm-hmm.
All right.
More like right at the top.
Okay.
Yeah, it's
Right
like, yeah, I can feel it. Mm-hmm.
So the scalenes have a referred pain pattern that goes down the arm, into the forearm, and into the first finger and thumb. And then let me have you turn all the way around.
Okay.
And it makes pain here as well. This is the most common cause of pain in the upper back. Period. Okay? Most common cause of pain in the upper back, the scalenes, the referred pain from the scalenes. You're feeling it through here. Sometimes people are going to feel it in their armpit a little bit. Maybe turn back
I'm
around.
feeling it too on the back side of my right arm.
Yep.
Right
here.
there. Yep.
Yep. So let's look up the scalenes.
Yeah, that's wild.
That's the referred pain pattern.
Because when I let up, that just completely goes away.
So this is the book that our book is based on. So the red is the referred pain patterns. And then the X's are where you're commonly going to find the trigger points. So you're
Oh,
on
that is
spot
really
right there,
something.
right
Yeah.
where that collarbone is.
So how long would I stay in this position?
Such a great question. So one, you follow what feels right for your body. In our book, we're going to say, stay on the spot for less than a minute.
Okay.
You could do a moving stroke from one side of the pain to the other, maybe 10 to 12 strokes. There's a lot of different theories about how to do it. Commonly, people, used to press and hold. Ergonomically, for self-treatment, that press and hold technique is a lot of work for people who are not used to doing massage. So we developed a technique of just of a moving stroke. What's most important is you do what's right for your body. So, and that, this arm gets tired, right, of doing that work.
Right. I was getting ready to ask about that.
Yeah, you take a
because my
break.
middle finger is already like, kind of achy from just holding it there.
Right.
Yeah.
So then when you come back to it in a minute, maybe you use a different finger. You don't want to use a tool. You don't want to use a Theracane. You don't want to use a knobble. You don't want to use anything like that on the front of your neck. You want to use your fingers so you can stay off the subclavian artery.
Okay.
And so you can stay off of the carotid artery. So where do you find the carotid artery? Right here, just under the chin on the neck. Now you can safely massage all of this stuff, but you just got to stay off the arteries.
Gotcha.
And my book details exactly how to do this, how to find it, how to stay off the artery, and how to treat this safely.
Okay.
Okay?
Okay.
All right. So this scalene spot right here, so you could come back and treat that on yourself. If we were having a longer session where I could teach you in detail how to come up the front of the neck and treat the scalene as it's all the way up here, how to treat the middle scalene, so if we find that SCM that turns the head and this big, beautiful muscle right here, we turn our head back to neutral. Just where my fingers land behind that, I'm on the middle scalene, and that's a safe place to massage.
Okay.
All right, so I could massage just right here on the very side of my neck. I think of this as the 50-yard line, okay? So if this was the end zone and this was the end zone, I'm on the 50-yard line. Do you agree?
Yes.
Okay, so I can massage all the way up here, all the way down to my collarbone. And I'm looking for little tiny spots that are exquisitely tender, and I'm just going to give them a little bit of love. I would use this hand.
This one? Okay.
So then we can really pinch that SCM. So as you turn your head to the opposite side, so turn towards me. There you go. You'll see and feel this SCM. So if you're doing this in the mirror, you'll see that SCM pop out, right?
Now I've got it.
Yeah, isn't that great?
Yeah.
So now you're going to come back to neutral with your head.
Okay.
There we go. And then where your fingers land, just here on the side of the neck, right? That's the middle scalene. And we describe in the book how to make sure you're on the middle scalene. There are brachial plexus nerves that run through here. In general, the nerves don't care unless they really care. And we would know because she would have yucky pain going down her arm. Yucky pain. Not like it aches sometimes, like a toothache. It would be severe, and I would go, what's happening with the structure, the bones, the discs, stuff like that.
Oh my goodness. This is like, this is, oh my gosh. Like incredibly tender right there.
So this is excellent. So stay on that spot, lighten up a whole lot. So what a trigger point will do, it will go from 1, 2, 3, 7, 8, 9. A nerve will go 0, 10.
That went 0, 10.
Okay, excellent.
Yeah.
So hold that spot and relax a second.
Okay.
There we go. Yep. Now, when you're on that spot, is it tender right now?
Yes.
Okay, but it's not a 10.
Not a 10. No.
Right. So we've been able to bring down the pain. What is it right now?
I'd say I've got that arm pain going on.
Got the referred pain here?
Oh, yeah.
Okay.
Definitely a 5. If I went a little harder, I think it would.
Like kitchen scale, like adding grams and ounces a little harder.
Right.
Then it gets yucky.
Yeah.
Yes.
Yeah.
That's a trigger point in the scalenes.
Oh, yeah. That's unbelievable. Okay.
Yeah, and this is your cranky side.
Yes.
Okay, so now we're going to give it a little love. So literally it's like, it's okay, little muscle. You don't have to work so hard right now. I literally say that. I say that to myself because here's the thing. You're in pain and you're tired of it, so you tend to want to beat it up.
Right.
Don't do that. It's not helpful. This muscle's connected to your nervous system. So how do we get things to calm down when they're overwhelmed, like a baby? Or your dog or your cat that's sick and overwhelmed and freaked out? You don't yell at them.
Right.
You don't touch them aggressively and move them around. But when we're trying to calm them down, we touch them gently. We use a soothing voice. We calm down. So our brain can literally amplify the pain and make things worse by how we're thinking about it and the stress. We can amplify it. And we can turn it down. Like the mothers that lift the cars off the children. And like we can turn the pain down so far that we can do amazing things to push through, to survive, to rescue, to do what we need to do. But for this, we want to pay attention to the sensation and we want to treat it at a level that feels therapeutic, but not too much, just gentle. It didn't happen overnight with this, and it's not going to go away overnight.
Right.
So let's treat it at a level that doesn't bruise, that we can come back to repeatedly and give it a little love. Okay, so your fingernails are kind of long, right? And, you might be committed to them for a while. If you, for example, decided that you really wanted to treat your scalenes on yourself, you might have your nails short and filed very short for a few weeks while you get your scalene trigger points under control, because it's going to feel really uncomfortable, and you're not allowed to use a tool. You have to use your fingers.
Gotcha.
Okay.
Is it a bad idea to use?
Nope, you can use your knuckles. Anything that it may be ergonomically not quite as fabulous, but we can find other ways to treat with your fingers.
But fingertips, that's best practice.
Yep, I might do this on this side. Fingertips. I might do my knuckle if I have to. Coming down here, I could use my thumb in this position. Just staying off of the pulse. That middle scalene is super easy to treat on yourself. And you can bring it all the way down here to the collarbone. Or you could walk across just above the collarbone and get all those little spots.
Okay.
Okay. Any questions?
I don't think so. That was fabulous. I can't believe that when I pressed in that area, it's hard to describe, but it did go from 0 to 10, and it was like a pinch, like a weird pinch.
Do you mind if I treat it on you?
Oh, I don't care. No, go for it.
So first thing, I'm going to find your sternocleidomastoid. All right, so scale of 1 to 10.
Woo!
Yucky.
5.
Oh, she said, ooh, and a 5. So we want 5 to be perfect. Is that still too much?
It's not too much, no.
Okay, all right. So I'm not using a ton of pressure, but just enough. And then I'm going to let go of that SCM. I'm going to press on this scalene just here and behind in the middle scalene.
Okay.
So I'm going to work really slow. Anybody tender in there?
A little bit, but not too much. But it's like, it can just like kind of happen all of a sudden.
This is good stuff. This is palpable. So that you have a palpable middle scalene, which means it's living taut and cranky.
That makes sense. Okay, yeah,
Right
yeah.
So then I'm going to go from one side of the pain to the other, and I'm going to see, I don't feel your sensation. I don't feel your pain. It'd be very handy if I did, but I don't. I can go in whatever direction is most effective with the least amount of effort. So is it this direction? Is it this direction? And what I'm doing is I'm staying on the same piece of skin, and I'm moving down. I can move up. I can move forward. I can move back. On self-treatment, you can really, they're like, oh, that's the exact angle. That's the exact direction of pressure. I'm just guessing and watching and asking for feedback. Yes, ma'am.
So I think up and down.
Okay.
I mean, just like the first time doing this, that feels like it might be more effective.
Like that? So I'm going to give that spot a little love, and then I'm going to get out of the way. The body is doing the work. It's changing the biochemistry. And
yeah, I can feel that.
For anything else that's tender. Yeah. And then keep coming down. So I can be really thorough. I might take 15 minutes to really explore through the scalenes, or longer. Or I could take a minute, and it's going to be beneficial and helpful. This was one of the first muscles I learned to intentionally massage on myself, because I was a mess when I was about 23. I'd had a back injury that I had acquired when I was 18. I think if I had gone to the doctor, they would have diagnosed me with fibromyalgia. I don't think that's what I had.
Right.
I think I had widespread myofascial pain that we solved. All the way down here.
Ooh.
Okay, right here?
Yeah.
Okay, let me have you do something else. So I can prove that I'm on the muscle that I think I'm on. So I'm going to have her take a staggered breath. So it's going to look like this. You only get to do this a couple times, and then you have too much oxygen. So you blow out all your air, and then you sniff through your nose 10 times until you can't breathe anymore. It goes like this. And we get into chest breathing. Keep going. So you blow out all your air. Staggered sniffs. Keep going, keep going, keep going, keep going, keep going, keep going. And I feel the muscle contract under my fingers. That's how I know I'm on the scalene.
Do I hold my breath?
Nah. There you go.
Whew, okay.
So we just get, and that was a little bit, it made it more intense, didn't it, when you contracted it? So that's another way. If you're on so I'm on a trigger point, I'm on a muscle, I'm like, gosh, what muscle is this? Make it do its action while you're pressing the trigger point. when you contract a muscle that you're holding the trigger point, it will be more intense on the trigger point and it'll hurt worse. And you go, okay, yes, for sure, I'm on that muscle I think I'm on.
That is so interesting.
So we're just going to give it a little love. Okay.
So now I've just put all the pieces together, because when you learn how to do this on your own, then you are going to figure out pretty quick what works and what doesn't.
Yes, you can't fool yourself.
You can't fool yourself.
Mm-hmm. Yep.
That is fantastic.
Yay.
Yeah.
Excellent. Okay, so I think your scalenes are involved with your upper back pain. So I would want, if you were coming to see me, I'd give them a really good, thorough treatment. If you were far away and you just had the book, or maybe you're a regular client and you've called me and said, Amber, I'm on vacation in Bermuda, and help me out. I'm going to teach you how to massage all 3 sections of that muscle safely, effectively, in a way that you feel confident about, so you can treat it regularly, daily on yourself, maybe 2 to 3 times a day. If the tissue starts to feel bruised and cranky, you leave it alone. Let it calm down.
Okay.
If we're doing this in an ideal kind of way, maybe we heat it up first.
Okay.
Do the massage. Maybe you don't get it done 2 or 3 times a day. Last thing you do before bed, do the self-massage, and you feel better in the morning.
So you can do this lying down, standing up,
Yes.
sitting, in any position?
Find the easy way. So
Okay.
For me, if I'm finding the easy way to treat my scalenes, I'm going to support my other arm and I'm going to sit at a desk. I'm going to find my SCM, I'm going to press on my scalenes, and I'm going to work all through here, just as lazy and easy as I can.
Okay.
So that's the most common place that's going to refer pain. It's also a little harder to learn how to massage on yourself, but you're going to want a resource, not just a drawing from the internet. You want a resource that describes exactly how to do it. The Trigger Point Therapy workbook is one of those resources. Another thing to do, like you said, you're sitting at the desk, right? And that myofascial release work really works well for you. So I think we should also learn to treat your pec muscles and probably your abdominal muscles. So I'm going to hand you one of our tools.
Okay.
So I brought a couple of different things. These are Theracanes, and I really like these for working on the chest on myself. So I can use my little handle. I'm going to work through the cloth so it doesn't abrade my skin.
Is it a good idea or a bad idea to use massage oils?
I don't use massage oils for self-treatment because I'm using the tool through the cloth. And I want to be able to do it wherever I need to do it. I think if we add massage oil, then it's the whole thing.
Okay.
All right, so then we're going to find a way to make this even easier and lazier. So I'm going to make my opposite side hand be the main tool.
Opposite side here?
Yep.
Okay.
So put this hand all the way
up here?
Yes, ma'am.
Okay.
Yep. And then this hand can drive the tool, but it doesn't have to work. So right now we're working on the pectoralis major, and I don't want the pectoralis major to do the work right now. I want the opposite side to do the work.
Okay.
So I can kind of stabilize this tool. I can work all the way from the collarbone. The pectoralis major comes all the way down here to the abdomen, all underneath the breast tissue, the sternum, the collarbone, and attaches to the arm. And its job is to move this arm over here. So what do we do all day long?
Right.
We cook. We do everything out here. So our pecs get a ton of work. They're overworked and underpaid. You go for a massage, you get all this work in your upper back, and your pecs, and then it's like, oh gosh, breast tissue, scary, right?
Right.
Well, you can teach, maybe you don't want somebody to touch your chest. You can treat this on yourself. All right, so you're going to have a tool like this. You can have any handheld massage tool like a knobble or anything else, and you can just use this to massage. You can work on yourself. You can work through the breast tissue as long as it feels comfortable to you. So if you find a spot that feels yucky, that feels cranky, that you can't make feel a 4 or a 5, get off of it. It doesn't want massage.
Yeah, this feels really, really cranky in here. Like more so than I would have even thought. I mean, it's like tight and yeah. That's something else.
Yeah, so you're going to give it some love.
Yeah.
It's okay, little muscle.
So when it feels like that, you just need to leave it alone. Is that right?
I would love it. I love on it.
Okay.
So I'm talking about what I mean by yucky is you go to touch it and it goes, no, I don't like it. And you go to touch it softer and it's like, doesn't hurt. No, I don't like it. You listen to yourself. You go, okay, yucky. But if you can make it feel therapeutically delicious, comfortable, a little bit painful, but you like it, you might also use a different tool. Maybe that one is too intense. Let's try the knobble.
Okay. We often let our minds run the show when it's our bodies that tell us what we really need to know.
Yes, listen to your body.
Mm-hmm.
You can always do too little. You can always do too little and see if you get away with it.
Right.
So this tool I really like because, one, it's wood and it's going to biodegrade. So I have 3 surfaces. I have this one, and this one. This is made and sold by a company called Pressure Positive. So pressurepositive.com is a great place to get massage tools, including the knobble.
Okay.
So I can use the edge of it and drag it and massage all through here. And then this arm is just going to chill out. So
Okay.
it could be in your pocket, it could be in your waistband, it could be on the desk. And if this was a lot of work for this other hand, I could add it in here. But in general, I want that pec to relax. I could add stretch to it if that felt good and appropriate.
Okay, so this is a move that a person needs to do when they have the shoulder pain.
Yeah, and in between shoulder
And
pain
in between,
yes.
okay.
So like, yeah. So I mean, all of us probably need chest massage to help open this up. We're spending time here.
Right.
This is short and tight. So you could massage it anytime that's convenient for you to help be able to pull those shoulder blades back.
Okay.
That we've learned all kinds of really great stretching and strengthening exercises, the doorway stretches, the pulleys to strengthen the rhomboids, and that's great. But if the tissue is taut, we need to soften the tissue and then stretch it. This is a missing piece. Soften the tissue, lengthen it, then stretch it, and it will maintain that length. If your stretching is not working, soften the tissue with massage and myofascial release.
Okay. That's good to know. It makes so much sense.
It's not rocket science.
Right.
So another thing we wanted to talk about was the breath, right?
Yes.
So the scalenes in the neck are an accessory breathing muscle. That means that their job is to raise the first 2 ribs to make space for the lungs to expand. And we have a whole lot of muscles that do that. It would be ideal if we were breathing with our diaphragm, which looks like expanding your tummy when you breathe. So if I'm going to do an abdominal breath, I fill my tummy with air, which means I let my tummy get bigger, with the risk of everybody think I'm fat, which is God forbid, right? So that's really deeply ingrained in us, especially women, but also men, right? We're not like, I'm supposed to be like this.
Be holding it in, right?
No, we have uteruses and bladders, and we have enough, right? We live in a time and a place where we get to have a little insurance against starvation. So
right.
So just, breathe, right? So just breathe. So we get to expand the abdomen. So this is really hard for some people because we hold in the abdomen, we feel stressed, we crunch our diaphragm, so we breathe up here. So people who've sung, people who play wind instruments learn how to do diaphragmatic breathing to get more air. So becoming aware, hand on the chest, hand in the abdomen, expanding the tummy to breathe, let the belly button float, so like laying on your back, let your belly button float up to the ceiling, and then as you exhale, pull that belly button in towards your spine. Not super overachiever, just pulling it in towards the spine. You could pull the pelvic floor up at the same time if you wanted to get an idea of what I'm supposed to be feeling. You might touch your lower abdomen, getting a sense of that, and then breathe and expand that tummy again. Yep, and this hand is going to monitor that chest breathing, and so we really before we get up here, because one of the things that can overwhelm the scalenes is making them work all of the time. So coming out of the chest breathing into more habitual diaphragmatic breathing. Expanding that tummy on the inhale, on the exhale, drawing it in. Yep. So you can really see your neck muscles contracting as you're breathing. So this coming into awareness with your hands, especially laying down in your bed, kind of a quiet time, coming into noticing your breath, is you get enough air, get enough air with the abdominal breath. Don't allow the chest to expand. Just training that body. You can also put your hands on your rib cage and go, okay, I want this to expand when I breathe. And that brings your awareness into the rib cage here. So this is important for a lot of different pieces. The breath, getting the transverse abdominis to stabilize, getting the diaphragm to do the breathing, rather than the mover muscles that we should save for moving, the scalenes and the serratus anterior and these other things. and our abdominal muscles get really cranky. You had talked about a pattern that goes across your back like this.
Yes.
Right?
Mm-hmm.
That is a referred pain pattern from a trigger point here in the abdomen.
Hmm.
So what do we do when we get at the computer? We bend in half, we do this, we get stressed, we get cranky, all of those things. You can get the referred pain, and you can also get your spinal erector muscles, those vertical muscles along the spine, to get cranky and tighten. They'll yell at you too. So what I want you to do is I want you to just press into your abdomen. So we're going to find the center here, the xiphoid process. We don't press on that bone at the very bottom of the sternum. We just come just down from it and to the side, and we have the ribs come through here and through here. And what we're looking for, and you just let your tummy be nice and loose and relaxed. You're pressing in and looking for anything tender through there. So I'm making a gang of fingers, as my dad would call it. I'm trying to get all my fingers on the same place.
Left side right there is very tender. Right there.
Okay. All right.
Mm-hmm.
So now,
significant difference from the right.
So let's focus on that left side for a minute. So I want you to tune into that sensation and tune into what your face feels like. When you notice yourself start to squint your eyes and hold your breath, think of that as a 6. So you need to lighten up the pressure so it's a 5. Now, if it feels so yucky you don't want to do it, just treat it up to a 3 or a 4.
Okay. So I'm just going to keep pushing until...
Just going to love on it a little bit.
Ooh, okay. Yeah.
So you could just do that conscious relaxation while you're working there. You could breathe and exhale. Yep. And then after a little bit, you can expand that search up onto the rib cage a little bit more, into the attachments and the fascia of the rectus abdominis, looking for anything else that's tender and love on that.
And again, I felt that pain radiating both across here and here.
So I'd want to unpack that. Now, typically this trigger point doesn't refer to those areas, but then I would say, well, is she using a muscle that does refer to these areas? Is the tension in the trapezius up here? Is she holding her breath? Is she doing the chest breathing to avoid the pain here and overusing the scalenes? So I try to unpack that a little bit. Or it's also possible that that muscle on you refers pain there, and that you just are exceptional, as we know.
So yeah, I mean, that is really something. How there's nothing over here. But then here, and I would have never thought to find that on my own. I mean, that is just crazy.
Yeah, this one's life-changing.
Yeah.
So this one also causes headaches by the posture. So you sit all week at your desk, preparing for a workshop, you're teaching with your dad, and you feel kind of stressed about it, right? And then you go and you stand up in front of people, holding your tummy in,
right?
Right? All of that stuff. And then you end up with a headache. So it took me a while to figure out, for me, this is a headache because of this posture and the stress. So when I get a headache, one of my best practices is to massage my rectus abdominis, my whole abdomen. This muscle's the 6-pack. It goes all the way down to the pubic bone. I could treat this whole thing. I could do a tummy squeeze where you're pressing and squeezing. There's all these techniques in the book about how to treat this. You can treat your own pubic bone right above the pubic bone here. And that makes a pain that goes across the low back like this.
Interesting.
Yep.
So all we do is we just explore.
Could explore.
Until we find a tender spot.
Yep.
And then we press in on it.
Yep.
Until it gets to the point of a 6, and then we want to lighten up. And then
Go
hold
for a 5.
that for less than a minute.
Yeah, go for a 5, and then come back to it. You might come back to it 2 or 3, 4, 5 times a day. You want to listen to your body. You don't want to bruise it and make it cranky.
Okay.
Now, how do we know that I'm not pressing on your stomach and your stomach is mad, or your small intestine, or your guts, right? Right? That's an important question.
Right. Yes, it is. Yeah.
First of all, we want to remember that our bodies are made to grow babies, and those babies get big, and they kick us in the bladder, and they kick us in the nerves, and all this stuff, and it's fine. And then all of that contracts and expels a baby. So first of all, these are not delicate structures that we're likely to hurt. There's one piece of evidence. Then think of the gymnasts, like we just had the Olympics, right? That bar is going across their abdomen. So on a healthy body, it's going to be okay, right? We're not going to harm them with our own hands. Not too likely. And we listen to our bodies. So if I'm pressing a spot and it goes yucky, or my intuition goes, I don't think that's a good idea, then I'm going to listen to that. If I press in and it's yucky and I can't make it nice, I stay off of it. It could just be gas, right? I might come back to it later and go, is that spot still tender? Do I need to ask my doctor about this? Is this not good? I might notice that. And of course, I listen to myself. And then there's another idea. So I press into a spot. It's not yucky, but it's tender. And I think, well, how do I know that this isn't my guts? So imagine I'm lying on my back on my bed. I can raise my head and shoulders up while I'm pressing on the spot. I can raise my head and shoulders. I can turn myself to the left. I can turn myself to the right. And I'm contracting the rectus abdominis, the external oblique, and the internal oblique in turn. If that spot goes away while I'm contracting, doing that little sit-up, it's deeper than the muscles. The muscles are protecting that spot that's tender. Then I might go, okay, we'll leave that alone.
Okay. Excellent information. God, yeah. That is just so...
And all that's in the book.
Yeah, that is something else. So when someone is using this book here, so in the back...
Let me show you.
Yeah.
So I'm going to start with, because we have all these muscle names, it can get overwhelming. So first thing I might do is I might start with the index, because it's broken down into areas of pain. So let's talk about chest and abdominal pain, for example, or maybe I want to go make sure I'm going to the abdominal muscles. So it's chapter 7. I'm going to turn to page 155. And this is where we get into the dysfunction stuff, right? So let's say that we've been having maybe our massage therapist, or maybe on the video, you're like, hey, we should go treat the abdomen. We come here to this section and then we have the pain guide. And the pain guide is going to tell us which muscles refer to which areas of the body. So chest pain, other parts of the abdomen, and it's going to give us a page number. We could also turn and go through the other symptoms guide, talking about different types of pain and other symptoms, nausea, for example. Testicular pain is in here, difficulty with urination, all kinds of stuff. And then we could flip and we could see all of the drawings from this chapter here, and we can compare the referred pain patterns. So in our book, the dot is where the trigger point typically happens, and then the little slashy horizontal lines are the referred pain patterns. It'll tell me what page to turn to, and then I turn and look for, there's the pectoralis major. So there's our pec major. You were just treating those trigger points right there. Typically cause pain in the front of the shoulder, but also do that dysfunction of rolling you forward, making it difficult to keep those shoulders back easily. Then we've got a section that talks about the symptoms, talks about the causes, and talks about how to do the self-treatment, like we just did.
Okay, I mean, this is absolutely fabulous. See, this book is like so easy to use. That's why I wanted to give a little demonstration about how to use the book. When someone gets this book, then they can just jump right into it.
Jump right into it. And in our next edition, we'll talk more about the dysfunction. We'll talk about more about how to put all of these pieces together. This book is very thorough on each muscle, how to find and treat each muscle. And I've added, with this third edition, more figure it out tools, what's going on. It's rarely one muscle. It's usually multiple muscles involved. And you work through it and you figure out, okay, what is the most important thing? But this book is less than $30.
Right.
The Theracane is $30, $35. That's cheaper than what you can get a massage for.
Right. No pills, no bills, no appointments.
Now, ideally, if you're seeing a massage therapist, you're seeing a PT, okay, so what's the most important muscle that I should be massaging? Take the book in with you. Talk to your massage therapist. If your PT wants you to stretch your pecs, massage your pecs. Talk to your practitioners about what you're doing at home. Is this appropriate for you? Is this a good idea for you? What can you do to support what they are doing in the clinic?
Okay. So do we have anything else?
Well, like I said, I could talk all day, but I'm going to hand this back to you.
I mean, I think that we have just started to change the world, if you want my honest opinion. I mean, this is really, really, really incredible. And I have known so many people who have lived with chronic pain. And for those who are watching right now, chronic pain is defined by a pain that lasts for 3 months or longer, right? It's the 3 months?
6 months, yeah.
3 to 6 months. Okay, so then that would put me in that category.
Yeah,
right.
You have chronic upper back pain.
Right.
Right. Right. So what else can we do? What else can we do to see what is the role of muscle in this problem? Are there trigger points that are contributing to that pain?
Right. Right.
We'll find out.
Yeah. So I hope you guys have enjoyed this. I know that it's going to help you. Please look up Amber Davies, buy the books, try these treatments.
And if you need some help, reach out.
Yes, yes.
Now you know newdaymyopain.com.
There you go. Now you know who to ask.
The Thought Snob Podcast with Paula Swope has been brought to you by Thought Snob Media in association with Special Purpose Studios. All production, mixing, and sound engineering by me, Will Swope. We hope you've enjoyed this podcast. Please take a few seconds to give us 5 stars and leave a review. See you on the next Thought Snob Podcast with Paula Swope.